The Health Consequences of Cigarette Smoking, presented by Ashley Outen. There are major health risks associated with cigarette smoking. Cancer is the #1 health risk associated with smoking. Your chances of being diagnosed with cancer increase with the amount of cigarettes you smoke daily and the number of years you smoke. Although cancer is most commonly found to affect your lungs, it can be diagnosed and occur in any part of your body. Smoking damages your body's cells, tissue, and blood vessels of the heart. This results in cardiovascular diseases such as coronary heart disease, the buildup of plaque in arteries which restricts blood flow, atherosclerosis, or in other words, narrowing or hardening of the arteries leading to and from your heart, aortic aneurysms, or weakening of a major artery, all in which could result in a stroke or heart attack. Did you know that smoking causes 90% of deaths from COPD? COPD is known as a respiratory disease referred to as chronic obstructive pulmonary disease. COPD is a chronic disease that makes it difficult for an individual to breathe. Pregnancy complications can happen if the mother is negligent during the time she carries her child. Low birth weight, prematurity, and health risks and complications can happen if the mother refuses to quit. Overall, your health can rapidly decline and cause major issues in terms of your body's normal organ functioning and immune system. To quit smoking is hard because it is an addictive behavior. However, the health benefits can lead to a healthier life right away. The air around you becomes clearer, your blood pressure improves, your body's carbon monoxide levels decrease, breathing becomes easier, and life becomes more enjoyable. Your risk of developing cardiovascular disease greatly decreased by 50% after just 1 year of quitting. Some of the effects of smoking are reversible. Nerve endings start to regenerate, your taste buds return, and sense of smell improves. Walking, running, and exercising gets easier, and your immune system gets stronger. Making your workplace a smoke-free environment will have a positive impact on your life. This will create a healthy environment and hopefully encourage all individuals around you to quit smoking. If you do not smoke, you do not have to worry about being subjected to secondhand inhalation and the negative impact that it has on your body and your life. A smoke-free environment could also result in lower rates on health, life, and disability coverage. Health direct care costs to the company may be reduced, which may result in raises and bonuses later on. Behavior change theories can be used to evaluate an individual's readiness to quit smoking. The social cognitive theory is a theory in which it proposes that people are driven not by inner forces, but by external factors. This means that an individual's environment can affect their choices and behaviors, which is another reason why it is so important for this workplace to go smoke-free. This theory can be determined and then intervened with positive reinforcements and outcome expectations. The theory of planned behavior suggests that behavior is dependent on one's intention to perform the behavior. With this theory, an individual has to want to change and have a positive outlook on the end result of making the choice to quit smoking. Role modeling is very important, especially in the workplace. Positive reinforcement is having the ability to work with your coworkers in a positive manner. This also leads to positive workplace outcomes that benefit not only you, but your employer. Outcomes such as higher levels of learning and positive change are a result of role modeling. Mentoring allows for acceptable behavior and teamwork to take place. This assures that a business and organization functions as it should. In terms of smoking, it is encouraged that you become positive role models for yourself and each other. Be your healthcare advocate and take the first step in making a positive change in workplace performance and behavior. The stages of change model is a process which aids in change. It starts with pre-contemplation, in which an individual makes a decision or intends to make a change. Then moves on to contemplation, which an individual knows the intention of change is a good thing but still has its cons. At this point, they process that change will happen. Planning is where an individual creates a plan to take action to change in the near future. Action stage is where the actual behavior change takes place, and maintenance is when the individual decides that they have control and the ability to accept and keep this change. When it comes to smoking, you can motivate change for an individual to quit through the stage of this process by reminding them that the benefits of quitting. The benefits of not smoking greatly outweigh all cons that are attached to smoking. This alone is a motivator. Smoking is difficult, but there are aids to help you during the process of quitting. Nicotine-containing gum is used to aid individuals with their cravings and to reduce the effect of withdrawal. With this particular drug, you can still continue to smoke, yet wean yourself down gradually. It is suggested that this aid be used under the guidance of your physician and in addition to counseling or support groups. Transdermal nicotine patches differ a little from the nicotine gum. With this method, you cannot continue to smoke. A prescription is needed from a physician and a process is started to wean the individual completely.